I'm Dr. Herbert Silverstein, President of the Ear Research Foundation and the Silverstein Institute. First thing I'm going to show you is a model of the ear and show you the three parts of the ear. So we have the outer ear, the pinna, and we have the ear canal here. Most commonly gets plugged up with wax. We now have the middle ear here. The eardrum is missing here, but the little bones of hearing are in this area here. And then we have the eustachian tube that connects to the nasopharynx that equalizes the pressure in the middle ear. We have the inner ear with the balance canals, the three balance canals, and the cochlea for hearing. First most common infection of the ear is the swimmer's ear. That's caused by frequent swimming in a pool and not drying the ears properly. What happens, the ears develop a fungus infection and sometimes a bacterial infection exacerbated by putting Q-tips in the ear and trying to put water in the ear to wash the ear out. Actually, you can just pull on the ear like this and touch the tragus here or pull the pinna, and that will hurt the patient because the ear canal skin is involved. Sometimes this becomes very painful and the patients come in for emergency care. The way we diagnose it is with a microscope, and we look in the ear. We can see debris, fungus debris or bacterial debris in the ear canal. The best way to treat it is to remove that crud that's in there with a suction and clean the ear out thoroughly, and then apply some antibiotic ear drops. Usually in several weeks, the infection goes away. If they use antibiotic ear drops for a prolonged period of time, sometimes a fungus infection will develop, and then we have to treat the fungal infection. So how do we prevent the swimmer's ear? We try to keep the ears dry. Keeping wax from reaccumulating in the ear is important, and I developed a solution of alcohol and aloe that we squirt in the ear twice a week in the shower. Discourages wax from forming. External otitis is very similar to swimmer's ear. It comes from use of Q-tips, digging in the ear, using hearing aids too often, or the molds irritating the ear canal. It's caused by water being used too often to clean the ears and the ears remaining wet. Many times the Q-tip will push the wax down into the ear and cause a hearing loss and cause damage to the ear. The treatment and prevention is very similar to swimmer's ear. The next topic we're going to talk about is acute middle ear infections. And these infections usually occur from a sinus infection or an upper respiratory infection. The infection starts in the nose or the sinus, and it travels up the eustachian tube and it goes into the middle ear. When it does, the ear fills up with pus and the ear becomes very painful. And the way you can tell just by examining yourself that if you pull the ear and touch here, it doesn't hurt, but it still have a lot of pain in the ear, and that's because the pus is causing pressure. So when the doctor looks into the ear, he sees a red eardrum, he sees a bulging of the eardrum, and he can see the pus behind the eardrum. It's usually treated for 10 days to 2 weeks with oral antibiotics, and that usually takes care of the problem. To help prevent the ear infections, if you have allergies, sneezing, runny nose, itchy eyes, you should have allergy diagnosis with skin tests and have the allergies treated by desensitization. The drops under the tongue are a great advancement in allergy treatment because the patient doesn't have to come into the office to have the shots done. We're going to talk now about chronic middle ear and mastoid infections. These occur in individuals with recurrent infections in their ear. And what happens is a perforation occurs in the eardrum, and it becomes a chronic problem with recurrent drainage in the ear. If they get a little water in their ear, the ear will become infected and it will start draining. There's a condition called cholesteatoma of the ear, where a cyst forms in the ear canal and starts growing and destroys the bone in the little bones of hearing, and destroys the eardrum and other structures around the area of the ear, such as the brain, the facial nerve, and the balance canals. We can diagnose that with mastoid x-rays and with examination of the ear under the microscope. But when we see a patient with chronic otitis media, they usually have a perforation in their ear and drainage and that's cleaned out with a suction under the microscope, and then antibiotic ear drops are instilled into the ear. Sometimes we have to give oral antibiotics also to quiet the infection down. And the treatment is surgical to repair the eardrum or to remove the cholesteatoma or the cyst. When the eardrum is destroyed and the little bones of the ear are destroyed, we can replace those with prostheses and with tissue to repair the hole in the eardrum. The next type of ear infections that we have are inner ear infections. And these are usually caused by a virus. And what they cause is an effect on the balance and the hearing organ. And the patient will have an episode of vertigo that may last for several hours or days if the virus infection hits the inner ear balance mechanism. And if it hits the cochlea, the patient will lose their hearing and have a nerve or sensory neural hearing loss. Now these conditions are an emergency for treatment. Once we see somebody with sudden deafness and losing their hearing from a viral infection, the treatment is high doses of steroids by mouth and also putting the steroids into the ear using a microwick that I invented about 20 years ago that allows the patient to put drops in their ear, steroid drops in their ear, and the drops go through the wick in the eardrum, and they can treat the deafness for a month with the steroid drops. After a month, we remove the wick and the tube and patch the ear with a little piece of paper, and it usually heals with no problem. If we're lucky and we treat the patient early, we have the best chance of restoring some hearing that has been lost. I just wanted to show you a little book that we're putting out that will be available from the Ear Research Foundation website. You can order this little book. It talks about how you can diagnose many of these problems in the ear by yourself and what the treatment is. At the Silverstein Institute, we specialize in treating these infections, and if you'd like to make an appointment, please call our office and one of our specialists can see you as soon as possible.